Welcome to Marian Ayurveda. In this episode, what we are discussing is a testimony from one of my patients. The main problem that person had, which brought them to see me for the first time, was fistula. Along with that, they also mentioned another important issue, severe diabetes. I told them that as we treat the fistula, their diabetes would also significantly improve. So, how does treating fistula help reduce diabetes? That's what we are going to think about in this episode, and I'll be discussing some of the root causes behind this. I am Dr. Anumod Kakkassery from Marian Ayurveda Thrissur, and with me is Anish Kumar from Kannur, who came here for the first time because of his fistula. Isn't that right? The main issue was the fistula, wasn't it? What kind of difficulties did you have because of the fistula?
After developing the fistula, I had a swelling near my anus. I didn't know it was a fistula. When I consulted a doctor in Kannur, I underwent an operation there, but about a month after the operation, I still didn't know what exactly it was, and I developed a persistent fever. When I went back to see that doctor, he told me to get another scan done. That's when he told me it was a fistula and said I needed another operation, but I wasn't interested in having another operation since I had already undergone one. That's when I came across Sir's video on YouTube, and that's how I ended up coming here. I have been taking medicine here for about 3 months. Let me also mention another benefit I experienced from the medicine. Previously, after fasting, when I ate, my sugar levels would be around 250 to 280. But after taking this treatment for my fistula, my sugar now stays around 130. One day I even drank 3 glasses of payasam, and when I checked my sugar the next morning, it was still 130.
The payasam I drank during Onam?
Even then, the next morning, my sugar was 130. Now my sugar is normal. Overall, I am very happy.
Has the swelling from the fistula gone away?
Yes, that's gone. The discharge stopped, and I have no other issues.
There is no swelling now, not at all. Remember, we did an MRI back then and found out that the fistula had a large tract.
There used to be swelling, but now there's nothing like that. I don't have any discomfort or anything of that sort. The discharge is normal, everything is functioning properly, and everything is going smoothly. But if I had known about this earlier, I wouldn't have done that surgery. Doing the surgery was just a waste, that's all.
Anyway, what we corrected here was the digestive system. That's why we haven't actually given any specific medicine for diabetes now. The fistula happened because our digestion wasn't proper. Our biggest problem was eating peanuts. Peanuts were the reason for the fistula and also for the high sugar levels. We stopped eating peanuts and avoided all kinds of nuts as well as underground foods like tubers. Plus, we only gave medicines that strengthen the liver and improve digestion. To be honest, there isn't actually any medicine to dry up the fistula. It was the body itself that healed the fistula. We just strengthened the digestive system, and when that improved, the diabetes also got better automatically. These are the only 2 diseases we're talking about. Often, for many diseases that people say have no cure, the situation is just like this. Once we correct the digestive system, both conditions, whatever the disease may be, will improve together.
Yes, that is right.
So like that?
The fistula got cured, and so did the sugar.
Sugar and fistula cause severe headaches.
Even though everything was certain.
Okay then. All right. Okay.
Thank you.
So in this particular person, what I found as the cause of the fistula was indigestion. The person was not able to digest food completely. There was a malfunction in the digestive system, which led to severe acidity in the stomach. We know that if you pour acid anywhere, it will penetrate and eat through whatever it touches. It has the power to create a hole or dissolve things. So the acidity caused by indigestion was the reason for this person's fistula. Similarly, the most fundamental cause of diabetes is a metabolic error or insulin resistance. What is insulin resistance and all that? All these are issues related to the digestive system. By correcting the person's digestion, the acidity goes away and automatically the body itself heals the fistula tract. Likewise, when the digestive system is corrected, the pancreas starts working properly, insulin production becomes normal, and thus both diabetes and the disease are cured. As we know, as the person mentioned earlier, the sugar level was very high, fasting was above 260, and it was a type of sugar that would not come down no matter what medicine was taken. By correcting the digestive system, we were able to fix it. We will meet again in another episode. Thank you.